Welcome to the Londonwide LMCs conference on securing the future of general practice in London. Last year in September, we published our document, Securing the Future of General Practice in London, and we set out the fundamental building blocks which are the essence of general practice and which we believe must underpin any change, whether it's evolutionary or transformational, to what happens in the future. All practices in London, every single one, are facing real, imminent, significant cuts in their funding against a doubling in demand for GP services, with 90% of activity continuing to be handled by us, never reaching the hospital door. Yet the community, social and mental health services that are the channels that enable those needs to be met have been decimated. Without them, it's no wonder that our patients, vulnerable or otherwise, are sent on a pillar-to-post merry-go-round of uncontrolled, uncoordinated care. But we also have other major problems in our city: poverty, migration, health inequalities, access to services. All this set against an impending crisis in our workforce and our recruitment of GPs, our practice nurses, and other clinicians and staff. Yet running through this, right through it, is the glue of continuity, which defines general practice in this country and is the envy of the world. And that glue continues to be thoughtlessly sacrificed at the altar of a now society. And on top of this, our infrastructure has been neglected for nigh on 2 decades. Boris, we need surgery upgrades now. There are the realities of general practice in the capital. These are the realities of general practice in the capital. And despite this, you and your teams perform miracles every day. You and your teams care for 250,000 patients this day and every day in this city of ours. That's the number of consultations that take place with you in your teams. That equates to every citizen in London seeing their GP once a month. And incredibly, with all this going on, 81% of them are satisfied. That's the biggest wow factor in healthcare in London as far as I'm concerned. We hoped that commissioners would have sorted all the problems out by now, but they haven't, and they won't, and they can't. We hoped they would commission to enable us to manage our patients better, but they haven't. So whether it's out of altruism or sheer survival, we have to take control of our own futures. And somehow, we have to make the sum of the whole greater than the sum of the parts. It is in our hands as providers of general practice in this wonderful capital city to take hold of the reins for ourselves and for our patients, and for the future health and well-being of our patients, about whom we care so very much. Until today, it's all been talk. Today, we do. In your packs, we've provided resources to help your thinking and planning. Today, we have gathered you, the genuinely great and the good, to listen, to work, and to share your thinking. I welcome you to the Londonwide LMCs conference on securing the future of general practice in this city. Thank you very much.